Welcome to this clinical sharing session. Today we will update the physiotherapy management for rheumatoid arthritis. This session is provided by Family Care Physiotherapy Clinic. Disclaimer before we start the session. Before we go to the main content, I want to revise few general concepts, especially for junior colleagues. When I was a student, I was told to manage RA like normal arthritis. But actually, when I study more and more, it is not completely correct. Especially the name, initially they make it, I find it's something not perfectly correct because rheumatoid arthritis is a systemic disease. It attacks the joints, ligament, but more important, it also attacks the internal organs, lungs and heart. So I never considered it as arthritis. I consider it as a disease, a systemic disease. That's why when I prescribe treatment, I also will monitor the cardiovascular system and provide some cardiopulmonary maintenance training for my patients. Another important concept is that no matter the research of physiotherapy say how effective the treatment to the quality of life, medication is always the most important, the first line treatment, very important, especially when the latest biological drugs are available. They can make the patient almost like asymptomatic, very effective. So if any cases you suspect arthritis, rheumatoid arthritis, never hesitate to refer for doctor for screening. Early medication can help the patient dramatically. The traditional physiotherapy treatment like pain relieving modalities, rest, laser, gentle joint mobilization. Remember, gentle, not extreme. Don't overstretch the ligament anymore. Strengthening, and more important, as I mentioned previously, cardiopulmonary training. They are also effective. Please keep them and continue to do that for the patient. The update I want to share with you is that, do you know nerve mobilization is a treatment for arthritis, particularly rheumatoid arthritis? It is a physiotherapy treatment for that. Quite new treatment actually. Over the last few years, our research teams has conducted 2 randomized control trials and published on the international peer-reviewed journals about the nerve mobilization exercise on patients with rheumatoid arthritis. And our research was cited in 2 publications, one systematic review and one clinical guideline related to European League Against Rheumatism. So you know this, our randomized control trial really contribute to the treatment of rheumatoid arthritis. Why nerve mobilization is associated with rheumatoid arthritis? As we mentioned, rheumatoid arthritis don't consider an arthritis. It's a systemic disease. It attacks ligament, joint, internal organs, and nerves. We found that from previous literature, a large amount of substance P nerve fibers were found in patients with rheumatoid arthritis. These fibers are very sensitive to mechanical pressure because of the swelling and edema. Those nerves are being compressed. When the nerves are compressed, they will release the neuropeptides, CGRP and substance P. These 2 substances are inflammatory mediators, then they trigger neurogenic inflammation, causing exaggeration of vasodilation and inflammation. Therefore, we apply nerve mobilization exercise to alleviate the mechanical pressure on the nerve and promote the circulation of the nervous system. Yes, nervous system has its own circulatory system. They circulate arthroplasm to maintain the metabolism and the health of the nerve. Because being compressed, the circulation is not good. We promote the circulation by nerve mobilization exercise. The results show that nerve mobilization exercise have better effect than normal joint mobilization exercise. It significantly reduces the pain or sensitivity to pain of the patient. But it is uncertain how it affects the level of inflammation because we did not measure the inflammatory substance. No budget, no research grant. Of course, not only our team, other researchers also found the mechanism of neurogenic inflammation, the role of nerve fiber, and they also apply nerve mobilization to osteoarthritis. However, the overall evidence is still very limited. That's why this treatment modality not widely applied in clinical practice yet. Also, we need to choose a particular group of patients to apply the treatment. First of all, the condition needs to be stable. If not stable, we apply nerve mobilization exercise may further trigger the neurogenic inflammation, will make it worse. Make sure the patient are stable, no flare-up of the inflammation. Secondly, the patient should be not receiving biological drugs. I'm not saying this is a contraindication, because as I mentioned, the biological drugs are very effective and useful. When the patient receives the biological drugs, they almost like symptom-free, so not indicate for the exercise. Those are for those patients that are not able to receive biological drugs and not too exaggerating inflammation. Then we prescribe the nerve mobilization exercise. Here's what I want to update with you with rheumatoid arthritis and nerve mobilization exercise. If you are interested in the paper, feel free to contact me. I give you the full text. If you like this session, please like and subscribe my channel. And here are the references. Thank you for attending the session. Have a good day.